Can you treat an ingrown toenail at home, or are you just making it worse without realizing it?
There's some at-home remedy that are gonna be helpful, but some other ones that can actually make everything worse.
Yeah. We're foot and ankle surgeons, and today we're breaking down 8 safe at-home ingrown toenail care, what works, what makes it worse, and when it's time for you to see a doctor.
Hi, I'm Dr. Blanchette.
And I'm Dr. Richard. I actually never had ingrown toenails until I was pregnant.
Really?
Yeah, you know, I wanted to look cute and I couldn't reach my toes. Yeah. So then I went to get a pedicure. They cut too much in the corner and I got ingrown toenails for the first time in my life. And it took me a year to get rid of it. Today, we'll share what actually helped me, and it's simple things that you can do at home.
I actually also had an ingrown nail, but unfortunately, home remedy didn't work for me. It was too far gone. And then thankfully, we're podiatrists. So one of my colleagues in Canada actually did a permanent nail avulsion on my toe. And then we're gonna go over that procedure in the next video. So make sure you subscribe to be notified when the next video comes up. If you're wondering, what is an ingrown toenail? Go check our video that we did last week. I'm gonna put the link in the description below. When to use home care treatment. Home care is appropriate for mild cases. So basically that means a little bit of tenderness, a little redness, no pus, no drainage or anything like that.
And even at that stage, you can still go see a doctor because we can help you with some conservative treatment that can really speed up your recovery.
Today we're gonna give you a lot of information, but you don't have to take any notes. We actually made a free printable PDF that you can get in the link down below. It's gonna go over everything that we're gonna talk today.
Number 1 is Epsom salt foot soak. So an Epsom salt foot soak is the safest first step when you have an early mild ingrown. How to do it? You're gonna use 2 tablespoons of Epsom salt per quart of lukewarm water. Then you're gonna soak your foot for about 10 minutes. You can also massage the skin away from the nail plate if it's not tender. And you're gonna pat dry it completely with a clean towel.
I usually don't recommend Epsom salt, not because Epsom salt is not good, but I tell my patients, if you have Epsom salt at home, good, use it. If you don't, just use table salt. Also, that's gonna do pretty much the same thing. Sodium chloride is table salt, magnesium sulfate is Epsom salt. They're both gonna help to draw the infection out, decrease the inflammation, and decrease the pain as well. Any salt basically is gonna help because it's gonna work with osmosis. So if you have a lot of salt or concentrated solution, and then you have some drainage gonna come out, the drainage is gonna be drawn to go into the water and not into your foot.
Basically, both salt won't fix the ingrown, but it can really calm things down.
Oh, really?
And when the skin is not that inflamed, the nail don't dig as much, doesn't become as much as a foreign body, and some patient can get away with it.
And then even if you have an ingrown nail that is draining, and then you made your appointment to the doctor, you can still do soaking. It's really gonna help to make it feel better in the meantime.
Number 2 is proper nail trimming. So basically, we recommend to cut the nail straight across. Okay, if your anatomy is a little curved, you can follow the natural curve of your nail, but never go really deep in the corner at an angle. That can make things way worse. If you see some skin, don't pull on it.
If you pull on the skin, that can cause inflammation. Inflammation is gonna cause swelling. So then there's gonna be even less space between your nail and your skin, and then the nail's gonna dig even more into the skin. Also, we don't wanna have nails that are too long or too short. So if it's too short, you can start digging into the corner. If they're too long and then your nail's already curved, once it's not attached to your skin anymore, it's gonna coil even more. So a general rule of thumb is that when you touch your toenail, you should feel the pulp of your toe, not the nail itself. If you have to cut your toenails once a month, do bathroom surgeries, and then go and then pull out your ingrown nail, you should probably see a podiatrist to have a more permanent solution. The other thing else that you could do, just follow the instruction in this video and see if you can actually help your toenail grow better over time. Toenails grow about 1 millimeter a month.
Very slow.
So it's gonna take some time, but we do have a lot of things to help you in this video.
Number 3, footwear. shoes play a big role with ingrown toenails. So make sure you have a shoe that has a wide toe box, but also deep. So you have enough space to spread out your toes and also wiggle them.
So you want to avoid any shoes that are pointy or too round at the front. It's going to cause a lot of pressure on the nail. You want to avoid tight socks. So shoes are one thing, but then what's in your shoes? It's your sock. If you have to wear compression socks, there's actually open toe socks, compression socks. They start over here and that helps a lot. Make sure that you wear shoes that are the right size for your feet, you know, like you don't want to jam your feet into something that's too small for you. So maybe consider having your feet measured. And then if it's the summer, well, it's easy. You can wear sandals. Number 4 is inserts or orthotics. Biomechanics can also affect ingrown nails.
Yep.
Because if you are overpronating, your foot rolls in more this way, it's going to put a lot of pressure onto the side of the toenail, onto the medial aspect of the toenail. By using an insert, it can support the arch better and decrease the pressure on the area.
Yeah, definitely in those cases, we need to treat the biomechanics. Otherwise, your ingrown will always come back.
It can be done by either using an over-the-counter arch support or also to get custom molded orthotics. And for that, you just have to go to see a podiatrist.
Number 5 is toe spacers. So toe spacers help, especially if your ingrown is on the lateral aspect. That means right next to your second toe.
And it's especially helpful with patients that have a bunion. The bunion, the toe is going to be dragged towards the second toe and it's going to be causing a lot of pressure. But with the toe spacer, it's going to decrease the pressure and keep those separate.
Number 6 is taping. This is a simple but effective trick.
Use a piece of tape. It can be athletic tape or also the sticky part of a Band-Aid. And then you're going to be pulling the skin away from the nail so it doesn't grow inside the skin.
Yeah, let's show you how it's done.
This is for an ingrown on the right side of the right big toe. You can use any type of tape, but we prefer the flexible material Band-Aid. So you're going to anchor the Band-Aid on clean skin on that right border. Then you're going to pull the skin away from the nail plate. You're going to wrap around to the other side to keep the skin off the nail edge.
Recommend my patient to do that overnight, right? At night, you're not sweating, you're not inside the shoe, so the tape will stay in place for about like 7 to 8 hours a night.
Yeah.
But also make sure you don't do it too tight. If you feel your heart pulse over there, it's too tight. Loosen it up a little.
Number 7 is to disinfect your shoes. We don't want the ingrown nail to become infected, so we want to try to decrease the bacterial load around the area as well as fungal load. And did you know that actually fungus and bacteria thrive in humid, hot environments? So in the shoe, it's just a perfect environment for them.
So what we recommend to disinfect your shoes are antifungal and antibacterial shoe spray. You can get those at the pharmacy, or if you want the professional strength, you can get it at the podiatrist's office. This is the first line of treatment. This is the number 1 we recommended because it's specially formulated to kill the fungus or the bacteria. If you want something that's more readily available, you want to start tonight, you can use Lysol spray. Almost everybody have that in their house. Another recommendation is to rotate your shoes. Don't wear the same shoes every day. Give them time to breathe out.
Exactly.
Yeah. Let them air out overnight, over 24 hours, 48 hours. Usually really loosen up the laces. You can also remove the insole to make sure they dry out properly.
Other option is also to use some UV light. So there are some inserts that can be purchased like on Amazon, and then you just stick them into your shoes and it's gonna disinfect the inside of your shoes. The other thing also is your shoe are old and then they are smelling, falling apart. Well, maybe it's time to replace those shoes.
Yeah, overall, the point that we're trying to make is that keep everything dry, even your feet. So if you sweat a lot, change your sock. If you go to the gym, bring a second pair of sock. And after you shower, make sure you dry your feet completely, and that means also in between your toes.
Number 8, you need to address thickened or fungal toenail early on. So the nail that have fungus have more chance of becoming ingrown. And this is because of a few reasons. First of all, they're going to be thicker.
Yeah.
So if they're thicker, they take a lot more room into your toe area. The second reason is because of onycholysis. So onycholysis is when the toenail is lifted from the nail bed. And as I was saying earlier, what happens if your toe is already a little curved, Well, it's not attached anymore to your nail bed, and then it's gonna start to curve even more. So that's another thing that can happen. So we want you to treat this early.
And go see your podiatrist, because we'll be able to do the proper diagnosis for you and also give you the treatment for fungal toenail. I think we need to do a full video on that.
We do, yeah.
There's so much to
So
say
many
about
things
that.
to do. But usually I tell patients avoid using the things that are over the counter. There's so many different things that are claiming that they're gonna, treat fungus toenail. It's just so much better to go see the podiatrist, have them evaluated, and then to get treatment professionally.
What makes it worse? So we just told you what to do, but it's important to tell you what not to do. We already discussed some of them. Don't dig at it. Don't pull that skin in the corner. You can get an infection or more inflammation.
There's like an old wives' tale of taking a little piece of cotton and then to put it, stuff it underneath the nail to, hopefully have the nail lift up. We don't really recommend this anymore. It's basically introducing a foreign object underneath the nail. It's gonna stay moist, right? Because it's cotton, it's gonna absorb the sweat, water from the shower. It's not gonna dry well, and it can lead to infection. It can lead to fungus, so we don't recommend that.
Another thing that is important is to not do bathroom surgeries at home, especially not with rusty tools you found in your garage.
No, please, no, don't do that. Please just don't ignore symptoms. If anything is getting worse, if you're doing everything above and then it's not getting better, just pick up the phone and then call your podiatrist to have a thorough evaluation and to see your doctor. So we don't want to rely on only home remedies if there's any worsening of your symptoms or any drainage or infection.
Active infection, yeah, definitely. Also, if you have recurrent, like you always keep on getting ingrown toenail, it's time to see your doctor.
Yes.
I had a patient that waited 6 months to see me. For 6 months, he had drainage, infection, and guess what? I took an x-ray and the infection went down to his bone. It happened once in my career, but be careful. You don't want that to happen to you.
Yeah. The reason also to go see the doctor is if you have to monthly have to do little bathroom surgeries, or if you have to get pedicures every 2 weeks.
Yeah.
It's not normal. There's other things that we can do to make you feel better. And then we're gonna talk about that actually in another video.
Okay, that's a wrap. Don't forget to get your free PDF so you can follow along to make sure you do the proper at-home remedies.
It's gonna be linked in the description down below. Please subscribe to the channel. We're gonna give you a lot more information about ingrown toenail in the next few videos, and we're gonna create a playlist with all of our ingrown toenails video. Let us know in the comment if you've ever had an ingrown nail and how you're dealing with them. And then see you next time.
Bye.